New Hampshire has 13 regional public health networks across the state designed to be entities that bring together partners from across different communities. So it's schools, municipalities, hospitals, law enforcement, all of the above, and come together to just understand and look at the overall health and well-being of that community.
All 13 regional public health networks are getting the President's Award. I can't think of 13 more tireless group of advocates. And it's just our way of thanking them for their tireless work over the years and being that kind of backbone for the whole state.
Part of what I think makes New Hampshire's approach so unique and special and important is the ability of our networks to be able to use local partners to develop local solutions. The public health networks are uniquely positioned to help be almost a bridge between what's happening at the state level and how that's impacting their local communities.
If those decision makers have good knowledge about what the needs are of their constituents and what's actually going on in their communities, they can make better informed decisions about the policies and the legislation that they decide on. If we are doing our job, then we're building trust and building those relationships.
We've done things like listening sessions. We've put out community surveys to get insight on what are people concerned about, what are our community members struggling with, and how can we help to bring their voices forward to create opportunity for legislative change and legislative advocacy.
We have developed what we call ISIs, which are intentional social interactions, where we invite people from the community to come and gather with us, and we have community conversations on health topics that the community lets us know that they're interested in. Maybe they can't make it to the State House, but I can. And so when I come bringing their voice to the table on very important issues. I think it's really important for lawmakers to hear from people who have boots on the ground. We are the ones that are having the experiences with the people in the community.
My background was in a hospital. I did not have a background in politics. New Futures has been a fantastic support. They've provided education. They've supported us at the State House, and they provide a breakdown of these bills because they are not common language. It is not easy to understand.
New Futures and New Hampshire Charitable Foundation have done a really great job of bringing all of our public health networks together to really share and cross-collaborate between regions to really create a collaborative voice for issues related to substance use, mental health, food access, housing, transportation, and other social determinants of health.
It's important for me to support the community. I know them. I get to spend time with them and hear what their concerns are. There's certain people that you really connect with, that you create a bond with, and I think building that trust has really helped our community.
In 2024, New Hampshire reduced our overdose fatalities by 35%. And so that's significant, and yet we still have a lot of work to do, but that couldn't have happened without the work of our public health system.
Advocacy work feels so impactful when you create that change that's going to have that trickle-down effect, creating new social norms, creating communities that are investing in the health and wellness of the public, right? Public health.
I applaud the work of all of the public health networks. New Futures would not be as effective in our own work if we did not have their partnership.